MP Don Loong will deliver his sponsorship speech on Parliament Bill number 150. May we respectfully recognize Engineer MP Don Loong, Mr. Speaker.
The honorable gentleman from Sulu is recognized, MP Don Loong, to deliver his sponsorship speech.
Thank you very much, Mr. Speaker, Majority Leader, ladies and gentlemen, fellow servants of government. I am privileged to present the Parliament Bill, which is an act providing for compensation to public and private health workers who may die of COVID-19 disease while in the line of duty in the Bangsamoro Autonomous Region in Muslim Mindanao, and appropriating funds therefore. Mr. Speaker, honorable ladies and gentlemen of this Parliament, distinguished guests, Assalamu alaikum. This representation is presenting for your consideration and seeking your good counsel and wisdom on the proposed Bill 151, an act providing for the compensation to public and private health workers who may die of COVID-19 disease while in the line of duty in the BARM. It is within our knowledge that COVID-19 disease has taken away the lives of many. It chooses no one to be afflicted with, may it be rich or poor, male or female, old or young individuals. Since the declaration of a global pandemic in March 2020 by the World Health Organization, many Filipinos, including the Bangsamoro constituents, have been afflicted by such disease. In the Philippines, healthcare workers are at the forefront of the fight against the COVID-19 pandemic that eventually puts them at high risk for infection. The sacrifice of our doctors, nurses, and other health workers to serve the sick and those afflicted with the fatal novel coronavirus to protect the Bangsamoro region should not be forgotten and deserves the highest commendation. In a report by the Philippine Statistics Authority, COVID-19 is the third leading cause of death in the Philippines from January to November 2021. Death due to COVID-19 virus identified were now the third leading cause, accounting for 67,000 deaths or 9.6%, rising from 14 with 8,300 deaths in the same period of 2020. The PSA explained in its report. On the other hand, BARM reported the least number of registered deaths with 149 cases. With these COVID-19 numbers, a total of 104 healthcare workers who contracted COVID-19 have died, according to the DOH. Based on the latest data, 24,284 workers have tested positive. 104 deaths make up 0.4% of the total infected health workers. As mentioned, the healthcare workers are part of the front line in the struggle against the pandemic. Many healthcare workers have been infected with the disease and have lost their lives during the pandemic. In support of those who had sacrificed their lives in line with their duty in the Bangsamoro region, this bill seeks to support our frontliners in the fight against the COVID-19 pandemic. This Compensation for Health Workers Act is envisioned to provide the healthcare workers an adequate compensation and benefits that are commensurate with their services. Most of all, it recognizes the paramount importance of public and private health workers for the continuous delivery of health services and efforts to render services during this period of pandemic. Encouragingly, the report rate of infections and deaths among healthcare workers has reduced over time, but we cannot be complacent. In the Bangsamoro region, as of February 2, 2022, the region has a cumulative total of 18,975 confirmed cases, 17,000 recoveries, and 884 active cases. The Bangsamoro government, for its part, recognizes the efforts and paramount importance of both public and private healthcare workers for their continuous delivery of health services, disease prevention, and promotion of health in general. These frontliners who made the ultimate sacrifice to fight against the pandemic by rendering service to the Bangsamoro region are entitled to be provided with financial assistance. No amount will ever be enough to repay them for their significant contribution to fight against COVID-19. But through this initiative, the families they left behind are supported and taken care of. Hence, this proposal for the Compensation for Health Workers Act of 2021. I therefore humbly request my esteemed colleagues to help me pass this bill.